Good evening students, I am Dr. Neha Jain. My today's topic is pelvis, female pelvis. So before jumping onto this topic, let us know that how the bone is held when an examiner asks you to hold any bone. Always hold the bone as if it is yours. Okay. So I will hold this pelvis like this, not like this. Okay. Now second most important rule is always hold the bone in anatomical position. So in anatomical position, that is on standing position, the pelvis is not horizontal, not parallel with the horizontal. It is inclined to an angle, that is angle of inclination, which is 55 degree. So I will hold this pelvis like this. Okay. Then the third important point is always hold the bone in fully supported position. Okay. So hold it like this, one finger here, one finger in the lower pubic rami, this little finger in the ischial tuberosity, and thumb behind the iliac bone. Okay. So these three important points you have to remember. Okay. Now the pelvis is divided into, anatomically divided into two: the false pelvis and the true pelvis. Okay. False pelvis is the pelvis above the pelvic brim. Okay. It is bounded anteriorly by the anterior abdominal wall. There is no bony wall. Posteriorly, it is bounded by the lumbar vertebrae and laterally by the iliac bones. Okay. Obstetrically, it has got no significance. Just it provides the support to the growing uterus. Okay. Now coming on to the true pelvis. Okay. Before going on to the true pelvis, let us see the true pelvis is formed by three bones. Two these innominate bones, and one sacrum, and the fourth bone is coccyx bone. Okay. This innominate bone is formed by the ilium, ischium, this ischium, and this is pubis. Okay, this is pubis. Okay. Now the true pelvis. True pelvis has got three parts. First is the pelvic inlet, then the cavity, and then the outlet. Okay. Now first the pelvic inlet. Pelvic inlet is a two-dimensional structure. Okay. So it has got only borders. It has not got any walls. Okay. The borders are from anterior to posterior. The upper border of inner surface of pubic symphysis, pubic crest, pubic tubercle, pectineal line, iliopubic eminence, iliopectineal line, sacroiliac articulation, inner surface of ala of sacrum, and inner surface of sacral promontory. Okay. This is the border of inlet. Okay. Now the axis of inlet. Axis of inlet is formed, before axis of inlet, let us see the plane of inlet. Plane of inlet is formed by the horizontal plane which passes through the boundaries of the any surface. Okay. So that is called plane. So this is plane of inlet, and the line passing perpendicular and in the center of the plane is axis. Okay. So the axis of pelvis, when it is in anatomical position, it is downwards and backwards. If you extend it anterior upwards, it touches the umbilicus, and posteriorly it touches the tip of coccyx. Okay. So this is plane of the inlet. Okay. Then the diameters of inlet. Diameters of inlet. See, first the shape of inlet. Shape of female pelvis is mostly gynecoid. Okay. So it is more or less round shape. Okay. So let us see the different types of pelvis. First is gynecoid pelvis. Gynecoid pelvis is more or less round pelvis. Okay, but it has got a slightly larger transverse diameter than anterior posterior diameter. Okay. Then coming on to the anthropoid pelvis. Anthropoid pelvis is anterior posteriorly oval pelvis, in which anterior posterior diameter is much more than the transverse diameter. The third pelvis is android pelvis. Android pelvis is more or less male type of pelvis, in which it is a triangular cavity. Okay, and the inlet is triangular. Okay, and the cavity is converging. The worst pelvis is android type of pelvis for any female to deliver a baby. Okay. Then coming on to the platypoid pelvis. Platypoid pelvis is flat, anterior posteriorly flat pelvis. So it has got long transverse diameter and a short anterior posterior diameter. So the best pelvis for delivery is gynecoid pelvis. The worst pelvis for delivery is android pelvis. Okay. Now coming on to the diameters of pelvis, diameters of inlet. Diameters of inlet, first is anterior posterior diameter of inlet. It is, see, what I told you, the gynecoid pelvis is more or less round. So it is a bit asymmetrical. So it has got anterior posterior diameter different, transverse diameter different, and also got an oblique diameter. Okay. Now anterior posterior diameter, there are three anterior posterior diameter which are called conjugates. First is anatomical conjugate or true conjugate or conjugate vera, which extends from the upper border of inner surface of pubic symphysis to the tip of sacral promontory. Okay, this is around 11 centimeters. Then second is obstetrical conjugate. Obstetrical conjugate extends from the most prominent part of the inner surface of symphysis pubis, inner surface of pubic symphysis, the most prominent part, to the tip of sacral promontory, which is around 10 centimeters. See, anywhere when you see the obstetrical diameter, it will be the shortest diameter, smallest diameter. So the third diameter is diagonal conjugate. Diagonal conjugate extends from the lower border of inner surface of pubic symphysis to the tip of the sacral promontory. It is the longest diameter. Diagonal is always longest. So it is around 12 centimeters. Okay. So diagonal conjugate is around 12 centimeters. Anatomical conjugate is around 11 centimeters and obstetrical conjugate is 10 centimeters. So the shortest diameter is always obstetrical. Okay. The obstetrical diameter is 10 centimeters. So the only measurable conjugate is the diagonal conjugate. So it is measured while doing pelvic examination with these two fingers, the index finger and the middle finger. When you insert inside, sliding from the coccyx to the inner surface of the sacral surface and trying to reach the sacral promontory. If you are not able to reach the sacral promontory through the middle finger, then it is a good pelvis. But if you touches the sacral promontory, then you measure the distance between the middle finger and the place where the lower border of the pubic symphysis touches in your hand. Then it will be that measurement will be the diagonal conjugate. And diagonal conjugate, when you subtract around 2 to 2.5 centimeter, it becomes obstetrical conjugate, and when you subtract 1 to 1.2 centimeter, it becomes anatomical conjugate. Okay. So these are three conjugates of or the anterior posterior diameter of the pelvic inlet. Now the transverse diameter of the pelvic inlet. Transverse diameter is the two farthest point horizontal, the horizontal line that passes through the two farthest point over the इलियोपेक्टिनियल लाइन, बोथ इलियोपेक्टिनियल लाइन में जो हॉरिजॉन्टल लाइन द फारदेस्ट पॉइंट को छू रही है दोनों के, दैट इज द ट्रांसवर्स डायमीटर ऑफ इनलेट. ओके, then which is 13 centimeters. Okay, now the oblique diameter. Oblique diameter extends from one of the sacroiliac articulation to the opposite end or opposite side of the iliopubic eminence. Okay, so the side determined is from the sacroiliac articulation. So this oblique will be right oblique because the oblique is starting from the right sacroiliac articulation, and this oblique diameter will be left oblique. Okay, the oblique diameter is around 12 centimeters. Okay, now coming on to there is one terminology called angle of inclination. What is this angle of inclination? See, the normally pelvis is not parallel with the horizontal. It makes an angle. So the inlet of pelvis, the plane of inlet of pelvis, that makes this plane makes an angle with the horizontal, that is called angle of inclination. Okay, see in this picture, the plane of inlet, see, plane of inlet is extending from the sacral promontory to the upper border of inner surface of pubic symphysis. So this is plane, and what the plane is making with the horizontal, which angle? This angle is called angle of inclination. Okay, this is around 55 degree. Okay, now what is the significance of this angle? See, there are two conditions. One is, sometimes what happens, the fifth lumbar vertebra get fused with the first sacral vertebra. Okay, so this is called sacralization of the fifth lumbar vertebra. So what happens, the effective the upper border of the plane of inlet becomes the fifth lumbar vertebra, upper border of the fifth lumbar vertebra. See, this will become the, now this will become the plane of the inlet, starting from the upper border of the fifth lumbar vertebra. So that is called high angle of inclination. Okay, high inclination. What happens when there is high inclination? High inclination होने से क्या हो जाएगा? The shape of the axis of the inlet will be disturbed. Axis disturb हो जाएगी, it will not coincide with the axis of the uterus. So there will be delayed engagement of the head. And what will happen? See, normally the sacrum is around, the sacrum is around, sacral hollow is around 11.5 centimeters. So baby has to pass through this 11.5 centimeter to come to the outer world. Okay, but when there occurs the sacralization of the fifth lumbar vertebra, additional 2 to 3 centimeter the birth canal increases. Okay, the birth canal increases to additional 2 to 3 centimeters. So there will be prolongation of labor. Descent will be delayed. Descent of the head will be delayed. So these are all significance, and it will also hamper the internal rotation of the head. So these are the obstetrical significance of high angle of inclination. Then the second terminology is low angle of inclination. See, sometimes what happens, the first sacral vertebra gets detached with the rest of the sacrum. So this is called lumbralization of the first sacral vertebra. So now the plane of inlet will start from the upper border of the second sacral vertebra. Okay, so the birth canal will be shortened, but it has got no obstetrical significance. See, obstetrical significance उसी में होता है जिसमें birthing में कुछ problem हो, but the low angle of inclination will not create any obstetrical problem. So it has got no obstetrical significance. Okay. Now this is all about inlet of pelvis. Now coming on to the cavity of pelvis. See, this is all cavity of pelvis. Now cavity is a three-dimensional structure. It has got plane as well as walls and a roof and a floor. Okay. Now the walls are anteriorly the pubic symphysis, pura pubic symphysis, inner border of pubic symphysis. Laterally the ischium bone, okay, and posteriorly whole of the sacrum. Whole of the sacrum. These are the boundaries. Roof will be formed by the plane of the pelvic inlet, that is pelvic inlet, and floor will be formed by the plane of least pelvic dimension or obstetrical outlet. Okay. So these are all, this is all boundaries of the cavity. Now it has got a plane. Plane is the what? A horizontal area which joins the points over any surface. Okay. So the plane passes from the most prominent part of inner surface of pubic symphysis, and posteriorly it extends to the junction of S2 S3 vertebra. S2 S3 sacral vertebra junction. So this is called plane. Now the cavity is more or less almost round in structure, almost round. It is so the if it is round, then it has got only one diameter, that is 12 centimeter. Okay, it will not, the anterior posterior diameter will not be different from the transverse diameter in case of rounded cavity. Okay, so it is 12 centimeter, and this plane is called the plane of greatest pelvic dimension. Okay, but it has also not got any obstetrical significance. Then coming on to the axis of cavity. Axis is what? The perpendicular line passing through the mid and mid point of the plane. Okay, so it is directed downwards. The direction of axis is vertically downwards. Okay, now axis हो गया, diameters हो गया, boundaries हो गई, everything we have completed of cavity. Now coming on to the outlet of the cavity, outlet of the pelvis. Okay, outlet is divided into two parts. One is obstetrical outlet, second is anatomical outlet. Okay, now obstetrical जैसे मैंने बताया, the diameters will be less as compared to the anatomical outlet. Okay, now first obstetrical outlet. Obstetrical outlet extends from the lower border of the inner surface of pubic symphysis, laterally ischial spines, these ischial spines, and posteriorly tip of fifth sacral vertebra. Okay, it is anterior-posteriorly oval surface. Okay, obstetrical outlet, and obstetrical outlet is just a surface, just a two-dimensional structure, so it will not have any walls. Okay, so the four important points in obstetrical outlet are inner border of inner surface of lower border of pubic symphysis, laterally ischial spines, and posteriorly tip of fifth sacral vertebra. Okay, now the diameters, anterior-posterior diameter extending from lower border of inner surface of pubic symphysis to the tip of fifth sacral vertebra, it is around 11 centimeters. It is around 11 centimeters. Okay, the transverse diameter extends from both ischial spines. Okay, this is called bispinous diameter, which is 0.5 centimeter less than anterior posterior diameter, that is 10.5 centimeters. Okay, 10.5 centimeter. Now हमने अभी तक कोई भी diameter 10.5 सेंटीमीटर का नहीं देखा है. ओके, सो इट विल बी द प्लेन ऑफ लीस्ट पेल्विक डायमेंशन. ठीक है, इसलिए इसे प्लेन ऑफ लीस्ट पेल्विक डायमेंशन बोला जाता है. ओके, नाउ प्लेन ऑफ लीस्ट पेल्विक डायमेंशन हैज गॉट मेनी ऑब्स्टेटिकल सिग्निफिकेंस. ओके, इस पॉइंट पे आके काफी चीजें होती हैं. फर्स्ट, व्हेन यू डू पेल्विक एग्जामिनेशन, द जीरो स्टेशन ऑफ हेड इज सीन, मतलब इज नोटेड बाय द लैंडमार्क ऑफ इशियल स्पाइन. सो इसी के लेवल पे हम जीरो स्टेशन बोलते हैं. ठीक है, अगर हेड इशियल स्पाइन पे है तो देन इट इज कॉल्ड जीरो स्टेशन ऑफ हेड. ठीक है, देन pudendal nerve passes from, see, the pudendal nerve exits from the greater foramen, then making an arch over the outer border of ischial spine and enters the lesser sciatic foramen from here. So the pudendal nerve passes here. So when we give pudendal block, the landmark is ischial spine. Okay, so this plane is, इसी plane पे हम pudendal nerve block देते हैं. ठीक है, then third, the baby's internal rotation, मतलब बेबी का जो हेड का इंटरनल रोटेशन होता है वो भी इशियल स्पाइन के लेवल पे होता है. ठीक है, देन फॉरवर्ड कर्व ऑफ पेल्विस भी यहीं से स्टार्ट होता है. ठीक है, फॉरवर्ड कर्व ऑफ पेल्विस भी यहीं से स्टार्ट होता है. ठीक है, सो दीज आर ऑल importance of this least pelvic dimension, plane of least pelvic dimension. Okay, now coming on to the anatomical outlet. Anatomical outlet is a cavity. Okay, so it has got walls as well as roof as well as floor. Okay, so anatomical outlet extends from the lower border of inner surface of pubic symphysis, then passing through the pubic arch. Okay, then ischial tuberosities, then sacrotuberous ligament, and posteriorly full coccyx extends to the coccyx. Okay, so this is all anatomical outlet. Okay, now the diameters of anatomical outlet, diameter is, see, the coccyx is movable. Okay, it has got hinge joint, so it is movable. ठीक है, तो when the coccyx is inwards like this, ठीक है, the anterior posterior diameter is around 10.5 centimeter. Okay, which extends from the lower border of the pubic symphysis to the tip of the coccyx. ठीक है, it is 10.5 centimeter. When the coccyx goes backwards, okay, backwards, when the baby descends, तो वो coccyx पीछे चला जाता है, then the diameter becomes 13 centimeters. Okay, and the transverse diameter is bituberous diameter, which is around 11 centimeters. Okay, bituberous diameter मतलब inner border of both this sacral tube, ischial tuberosities. ठीक है, so it is bituberous diameter, which is 11 centimeters. Okay, now the axis of outlet. Axis of obstetrical outlet is vertically downwards, and axis of anatomical outlet is downwards and forwards. Okay, so now the pelvic axis, what becomes? Pelvic axis क्या हो जा रही है? Inlet की downwards and backwards, then in cavity vertically downwards, and then outlet downwards and forwards. So it becomes a C-shaped curve, which is called curve of Carus. Ideally, the baby should pass through this curve. Okay, but actually it does not pass through this curve. It passes, see, downwards. The baby's head passes downwards and backwards till it reaches the ischial spine, and then it curves forwards. Okay, सो ये अभी मैंने बताया था ना इसका इंपॉर्टेंस कि फॉरवर्ड कर्व ऑफ पेल्विस स्टार्ट हो जाता है यहाँ पे, तो यही हो जाता है कि हेड यहां तक डाउनवर्ड्स एंड बैकवर्ड्स आता है एंड देन फॉरवर्ड्स हो जाता है, ठीक है। तो दिस इज कॉल्ड ऑब्स्ट्रेटिकल कर्व, ओके। The curve of Carus was anatomical curve. Actually, the baby should pass through this, but because of various soft tissues and other organs in the pelvis, it passes from downwards and backwards till the ischial spine and then forwards. That is called obstetrical curve. ठीक है? Now, there is a terminology called waist space of Morris. See, what happened? This anatomical outlet is around irregular सी कैविटी है ना। तो बेबी जब डिसेंड करता है तो इस प्यूबिक आर्च पे पूरा प्यूबिक आर्च यूज नहीं कर पाता, पूरा प्यूबिक आर्च यूज नहीं कर पाता, ये थोड़ा सा स्पेस रह जाता है, सी लाइक दिस, ये स्पेस ऊपर ये रह जाता है स्पेस, ठीक है ना। तो दिस स्पेस इज कॉल्ड वेस्ट स्पेस ऑफ मॉरिस. It should not be more than 1 centimeter. If it is more than 1 centimeter, the baby's head is pushed backwards to utilize the back area of the pelvis. So there will be pelvic tear, मतलब the perineal tear बहुत ज़्यादा हो जाएगा उसमें, ठीक है, अगर वेस्ट स्पेस ऑफ मॉरिस ज़्यादा है. और एंड्रॉइड पेल्विस में वेस्ट स्पेस ऑफ मॉरिस बहुत ज़्यादा रहता है. द थर्ड पेल्विस which I told you, the worst pelvis, इसमें वेस्ट स्पेस ऑफ मॉरिस बहुत ज्यादा रहता है, तो बेबी का हेड पूरा पोस्टीरियरली पुश हो जाता है, ठीक है. तो दिस इज कॉल्ड वेस्ट स्पेस ऑफ मॉरिस. नाउ अदर टर्मिनोलॉजीज आर, वन इज द आर्च ऑफ प्यूबिस. सी दिस इज द आर्च ऑफ प्यूबिस and this is pubic angle, okay. This is pubic angle which when the two pubic rami unites above, it forms a pubic angle. In gynecoid pelvis it is around 85 degrees, ठीक है. So ये जो एंड्रॉइड पेल्विस में ये और कम होता जाता है और प्यूबिक आर्च कन्वर्ज होता जाता है, ठीक है ना. तो प्यूबिक एंगल कम होता जाता है, ठीक है. और प्लैटिपॉइड पेल्विस में इट इज वाइड पेल्विस, ठीक है, वाइड. नाउ देयर आर 4 joints in the pelvis. First is pubic symphysis, which is secondary type of fibrocartilaginous joint. It has got no capsule, no synovial fluid, but during delivery of the baby, it shows gliding movement and which facilitates the movement of descent of the baby. Okay. Now the second joints are the sacroiliac articulations, 2 sacroiliac articulations, which is a type of synovial joint. It has got synovial fluid and a capsule surrounding the synovial fluid. The last joint is sacrococcygeal joint, which is also a type of synovial joint. It is hinge type of synovial joint. So it has also got capsule and synovial fluid inside it. Okay. Now this is all pelvis. Thank you.